Hi, this is Dr. Ruscio, and let's discuss sun exposure, skin cancer, and your overall health. You've probably heard conflicting things about the sun, right? On one end of the spectrum, you've probably heard some people commenting that the sun is something that has a lot of health promoting properties, the sun and vitamin D. And there's also probably some concerns that you hear maybe from more of the dermatology community about skin cancer. Well, a recent study was published looking at what effect does sun avoidance have on your overall health. And this study looked at a large group of women, about 29,000 women were followed for about 20 years. So a very well-performed observational study. And this was a group of women that had previous skin cancer and were recommended to avoid the sun because of the potential effect of excess sun exacerbating the skin cancer, of course. What they found was very, very interesting. The overall death rate in the group that practiced the most sun avoidance was about twice as high when compared to the group that obtained the highest level of sun exposure. So essentially, what this study has found in observing about just under 30,000 women for about 20 years was that even in women who had a previous history of skin cancer, those that practiced the highest level of sun avoidance had a 2 times higher likelihood of dying compared to women who obtained the most sun exposure. So, what does this tell us? Well, it tells us that we may want to rethink the recommendation to avoid sun very strongly, and that sun exposure, potentially when practiced responsibly, may have many health benefits. Now, I've put together previously, and I'll include the link for it here, recommendations to help guide you in obtaining reasonable sun exposure. And if you follow these recommendations, I think that, in my opinion, but I think you'll get all the benefits from the sun and minimize the risk of detriment. There are some, we have to be a little bit careful with how we interpret this because this was observational, it wasn't a clinical trial, but I think in my review of the evidence overall that sun avoidance will do more harm than good, especially if you're someone that's trying to navigate the potentially conflicting and confusing recommendations regarding should I obtain sun exposure or should I avoid sun exposure because of the potential cancer detriments that it may pose. Now, there's a couple important things that I should mention, which is you never want to burn, and if you look at the recommendations that I outlined, that's very much so emphasized. So you don't want to burn, A. And B, can you obtain these health benefits from supplementing with vitamin D alone? And if you look on my website, you'll find, along with this other link that I provided where I give the vitamin D recommendations, the sun exposure recommendations, you'll see a review of some of the latest research on vitamin D, which shows that the results of vitamin D supplementation are very disappointing, and that there are many health benefits that seem to be derived exclusively from sun exposure and not from vitamin D supplementation. So it's important for me to emphasize that you can't just take a pill or a vitamin D supplement and expect to obtain all the same benefits that we see from sun exposure. So in recap, more and more evidence is continuing to emerge showing a link between your sun exposure and your health. This study I thought was a very well-performed study showing that even people at the highest risk for danger from sun exposure actually seem to have an overall benefit from it. And I've laid out some guidelines for how to obtain a reasonable level of sun exposure safely, and also that you can't obtain the same benefits from the sun through supplementing with vitamin D. Okay, this is Dr. Ruscio, and hope that helps. Thanks.